We're going to cover the medication aid in service today. I want to go over the VNA policies and procedures for giving medications. VNA will pay for your home health aid medication license. It's $18, and after you watch this in service today, you'll take a quiz. You have to get 100% on the quiz, and if you don't get 100%, you'll be allowed to retake it. And then they'll send your the license to your home in 2 or 3 weeks. And when you get that license, if you would stop by the front desk and show it to Stephanie so she can make a copy for our records. Then in about 2 years, you'll get a renewal notice, and if you would just kind of keep track of that, they probably will send you a couple months ahead of time when that's going to be due. If you would just notify me or your supervisor so we can make plans for you to redo the test. That's all you'll need to do for your renewal, is to renew the test, and then we'll go ahead and send in the fee and the paperwork to the state again, and you'll get your renewal. First thing we're going to go over today is hand washing. Of course, that's always the first thing we go over. It's still very important, and it's still the #1 way to control infection. There are some updates, however. We should try to use the pump soap. You should carry your own or use the client's. Don't use bar soap because it can sometimes be dirty. Wash your hands for a good 15 to 30 seconds. Leave the water running. After you wash your hands, have your paper towels ready. You should carry paper towels with you in case they don't have any. And then dry your hands with a paper towel, then use the paper towel to shut off the water so your hands stay clean. If the client is going to be assisting with giving their medications, you should ask them if they would please wash their hands also. I wouldn't use their towels. That's why you need to carry paper towels, so you can use your own soap and your own paper towels, because their towels could also be soiled. The next thing we're going to go over is HIPAA regulations. HIPAA is the privacy policy they came out with, a federal policy several years back. The main thing to know is that you can't share any information. It doesn't necessarily have to be confidential information, but you can't share any information with anyone about the clients that you see. You don't want to call another client at one client's home, because then their phone number will show up and that other client might call the patient back. You have to be careful of things like that. And if somebody calls you on your phone, make sure you don't use the client's entire name in front of another client. It's not just the sensitive information, but just the fact that we're seeing a client has to be kept confidential. When you're carrying your paperwork around, it's always a good idea to put it face down so that people can't read the name. If you're leaving a home and a neighbor or somebody, a friend of the client, wants to know how they're doing or to have an update, just tell them that you're not allowed to give out any information, and that they would have to contact the family member to get some information regarding that client. Just so you know, if you're ever asked to do medication administration or any procedure or policy that you're not comfortable with, please notify your supervisor or notify me. I'm the home health aid coordinator, and I'll be happy to make a shared visit with you until you're comfortable. We're going to go over the 5 rights of medication administration today. Of course, the first one is the right medication, and then the second is the right client or patient, and you need to confirm with 2 separate forms of identification that you have the right client. Their address can be one. You can ask them their birth date. If there's a family member there, you can have them confirm the ID of the client. So that 5 rights, right medication, right client, right dose. You can only give the amount specified on the patient's care plan, and of course you can't give any medicines if they're not specified clearly on the care plan made by the nurse. The 4th right is the right time, and the 5th right is the right route. So that's right medicine, right client, right dose, right time, and right route. You want to hold the bottle up and compare it to the care plan side by side. Read the bottle and the care plan before you open the bottle, and then after you prepare the medicine to give it, and then as you're putting it away. It should be checked 3 times. And remember that documenting that you've given a medicine is part of administration. It's pretty easy, and with our care plans, all you have to do is check off that you did give the medicine, and that's all you need to do. You should remember to check the care plan. They are updated at times. I would hope any nurse, or if I'm doing it, I would notify someone that there's an update made so that you can get a new copy. But also, it's part of your responsibility to check to make sure that you have an updated care plan with you. Med-Aids that work for the B&A will follow these procedures. You may assist or remind in giving medications, including the storage of meds, the handling and opening of the containers, time reminders, assist with application of topical ointments, and you may give a unit dose of the medication. Actual administration of any med is only allowed if it's on the care plan. Always carry a current care plan with you, and if a patient is mentally able to tell you what medication he is to take, but not physically able, you may assist him in taking that. Now, some of the clients we see will be confused, and they won't be able to tell you the medicine. They must be able to put that pill in their mouth themselves with you guiding their hand. Sometimes people with dementia or people that are confused will refuse the medicines. Don't make a big deal out of it. Say, okay, that's fine, and just go on about doing some other procedure on the care plan. Just let it go for 5 or 10 minutes. Then reapproach them, maybe with a different style. Maybe say, the doctor would like you to take this pill, and don't tell them they have to take it. That will just make them more set not to take it. Just kind of pleasantly, gentle reminders work the best. And then try it again. And if they still refuse the second time, if there's a family member there, you can ask them to assist, or you can just chart that they refused the medicine. You'll need to notify their nurse or case manager if they won't take the pill, so that they can be aware that they're not getting that medicine. Sometimes giving them some input on the situation. Ask them what they'd like to drink with the pill, or if they want it crushed, if that's okay to crush it. Let them take part in the decision, and that will usually make them more compliant. Liquid medications can only be given by Med-Aids if it's been pre-measured by their nurse or by a family member. You may assist with powdered medicine, powder in packets, eye drops, ear drops. Remember, for an adult, you pull the ear down and back to administer ear drops, and then you want to slightly just gently put a cotton ball in there for a few minutes and have them sit still so it can be absorbed. You can help with nasal sprays or nose drops. You can also assist with PRN medications if the care plan states that you can assist with PRN medications. You cannot assist with inhalers. The patient will have to do that themselves. The next thing to think about is any items that may have chucks, briefs, any items that may have blood or body fluids have to be double bagged. Just put it in a plastic bag, tie it up, and then put it in another plastic bag. Anything that you're working with the patient should be double bagged. If there's needles in the home, they need to be discarded in a hard plastic or a metal container, not just thrown in the trash. If you see that a patient is just throwing them in the trash, you should notify their nurse or their case manager so they can get them a sharps container so they can be disposed of properly. If you're giving a medication to a patient, a pill, and it falls on the floor, our policy, it's a JACO policy actually, is to throw the pill away and not to use it. But when you're working in the patient's homes, it's kind of their choice. Some of the medications are very expensive. If the patient says he doesn't want you to throw the pill away, you can tell them they'll have to use the pill themselves. You can't give them that pill, but you can save it for them so they can use it later. Some unsafe conditions that you want to be aware of when administering medications. If you have a bottle of medicines and the label is unreadable, if it's missing or it's wet or something, you can't read clearly what the medication is and what the dose should be, you can't give any medicine out of that bottle. Always check the expiration date on the bottle, and if it's expired, you can't use it. Never give a child an adult dose of medication unless it's ordered by an MD. And if you suspect patient is having an allergic reaction to a medicine, of course you'd want to hold it. You'd want to stop and think about that. If they've started a new medicine recently and they're complaining of itching and hives or something like that, you'd want to notify their nurse. Remember to keep in mind some people have latex allergies, but that should be on their care plan. If for whatever reason you don't give a medication, notify the case manager or notify me if you can't reach the case manager. Some of the more common side effects you will see from oral medications would be skin irritation, rash, itching, hives, sometimes change in behavior, anxiety, or just the opposite, lethargy, stomach upset, nausea, vomiting. They start to shake. Those are the main things you'll see with the medication, and if you suspect that is happening because of a medicine, don't give the medicine and notify their nurse and their family as soon as you can. Just want to remind you that you probably spend a lot more time with the patients than the nurses, so you need to be the eyes and the ears for the nurse, and if you see things that just don't seem right, just call the nurse. I'm sure they'll all be happy for any input you can give them with the patient. Some of the more common medications people see and problems you have with medicines. Pain medications, of course, you have to worry about people becoming constipated, so it's a good idea to help them keep track of when they're having BMs. If a patient tells you they're just starting on an antibiotic, could be they might have diarrhea for a few days. Usually goes away, but if it's a problem, let the nurse know. If a patient tells you they're taking blood thinners, Coumadin, you want to report any signs of bleeding, bloody nose, pink urine, a lot of bruises, report that right away to their nurse. If somebody's a diabetic and they're on insulin, you see things like, all of a sudden they'll start sweating, they'll get shaky, they might get irritable or anxious. That's possibly a hypoglycemic reaction, and you'd probably want to try to give them some juice, or at least ask them if they think they should take some juice and maybe a sandwich, and then have them, if they can, check their blood sugar. That's everything for today, but just remember, if you ever come across on a care plan something you're uncomfortable with, feel free to call me. My name is Wanda Haston. I'll be happy to help you whenever I can. Thank you.